After going through something as huge as major heart surgery, life is just full of new questions. But maybe one of the biggest, most personal questions that comes up is about the future, right? About building a family. It's a question that goes way beyond medicine and gets to the heart of our deepest hopes. So let's dive into it.
So let's just get right to it. This is the question on so many people's minds. After all this, after getting a mechanical heart valve, can I still have kids? Can I have a family? It's such a valid and incredibly important thing to ask, and in this explainer, we're going to get you the clear answers you're looking for.
And I'm not going to make you wait. The short and honestly the really wonderful answer is yes. It is absolutely possible to become a parent after receiving a mechanical heart valve.
But, and this is a really important but, it's not a journey you just jump into. The absolute key to making sure everything goes safely and successfully is to approach it with your eyes wide open, with a great medical support system, and with a really, really solid plan in place.
Let me take just a few seconds to say that, if you'd like to support my project, you can offer me a symbolic coffee on Ko-Fi. You'll find the link below in the description. You can also check out my book, where I've gathered many experiences and useful tips. Every gesture means a lot to me and truly helps me keep this channel and the whole project going. And if you haven't done it yet, I invite you to subscribe to the channel, turn on the notification bell, and visit my website or blog for more content. Thank you from the bottom of my heart.
This really is a life-changing question, and, the path forward, it's not one size fits all. In fact, there are some pretty significant differences when we talk about the journey for men versus the journey for women. And you can see here, we're really talking about two very different journeys. For men, the path to becoming a dad is usually more direct. The valve itself and the standard medications, they typically don't mess with fertility. For women, though, the journey to motherhood needs a lot more hands-on medical management, especially when it comes to the medications you need during pregnancy. Okay, so let's start with what we're calling the more direct path, fatherhood. Now, even though there are fewer medical hurdles here, being prepared and knowing what's what is still absolutely crucial.
So, for all the fathers to be out there, here's the deal. The big takeaway is that neither the mechanical valve nor the usual blood thinner, warfarin, is going to affect your ability to have children. Now, another big worry is often about passing the condition on, but in most cases, that's not an issue. The exception being, of course, if your original heart problem was caused by a genetic condition. So what's your job? It's to stay healthy, keep your INR stable, that's just a measure of how thin your blood is, and, super important, keep your partner in the loop about your health and your meds. All right, now let's shift our focus to the journey for women. It's a bit more complex, and it really calls for a careful, thought-out, well-managed approach. This is where planning and specialized care become everything.
For women, the challenges really boil down to two main things. First up is the medication. Warfarin, that standard blood thinner, can be risky for a developing baby because it can cross the placenta. That's a no-go. The second thing is just the incredible physical demand of pregnancy itself. Your body creates more blood, and your heart has to work so much harder to pump it all. That extra workload, that cardiac load, needs to be watched like a hawk.
So how do you handle those challenges? Well, it's not about avoiding them, it's about planning for them with a clear, managed process. Notice that this whole thing starts before you even try to get pregnant. You meet with your team to make a plan, and that plan is almost definitely going to involve switching from warfarin to something safer, like heparin injections. Why? Well, think of it this way. The molecules in heparin are just too big to sneak past the placenta and get to the baby. And then for the next 9 months, close monitoring becomes your new best friend. Lots of checkups to make sure you and the baby are doing great.
Okay, let's circle back to a concern that really matters to both men and women. This question of passing your heart condition onto your children. This is a huge worry for a lot of people, so let's get really clear on the risks. So, is it hereditary? Well, the answer really depends on why you needed a new valve in the first place. If your valve problem was just degenerative, caused by age or simple wear and tear, then there's no direct genetic risk to pass on. But if your valve replacement was needed because of a known genetic or congenital condition, something like Marfan syndrome or a bicuspid aortic valve, then yeah, the risk for your kids is higher. And in that case, talking to a genetic counselor is a really smart move. Okay, we have covered a lot. So what do you do with all this information? Where do you go from here? Well, you take it all and you turn it into your own clear, actionable game plan. This is how you move from what if to how to. And here it is.
This is your roadmap. Step 1, and this is totally non-negotiable, talk with your cardiologist. They know you and your heart best. For women, Step 2 is finding a high-risk OBGYN, someone who gets the specifics of cardiac patients. Then, together, you build that personalized plan we've been talking about. And please, don't skip Step 4. This is an emotional journey just as much as it's a physical one. Reaching out for support from counselors or other patients, that's not a weakness, it's a huge sign of strength.
So, I really want to leave you with this idea because it sums everything up perfectly. Having a mechanical valve doesn't mean you have to give up on the dream of parenthood. Not at all. It just means you get to approach that dream with a little more awareness, a lot more preparation, and an amazing support team right there with you.
And of course, just a quick reminder that all of this is for your information. It is absolutely not a substitute for real professional medical advice. The most important conversation you can possibly have is the one with your own doctor about your specific personal health situation.